Diabetes is a national epidemic. There are some estimates that as much as 2/3 of the American population will have diabetes in the next few years. There are some problems that are peculiar to diabetes, and some of them have to do with diabetic wounds of the feet, of the leg in particular, to very difficult to treat chronic wounds, which can involve all sorts of tissues, from the skin, the deeper tissues, even the bone, and they make for a difficult challenge for healing. And these, unfortunately, can sometimes lead to major tissue loss and amputations. They are a major cause of amputations. And the exciting thing is that with dedicated wound care involving physicians who are trained to do so, nurses, dietitians, all sorts of specialists, that we're able to save many limbs which would otherwise be lost. Hyperbaric plays a very important role in that care as well.
If a patient is felt to be an appropriate candidate, then they would be brought here on a very regular basis, usually once a day, up to 20 or 30 treatments. And these treatments involve our hyperbaric oxygen chambers. Patients will spend approximately 90 minutes in those chambers. And during this time, they will be experiencing very, very high concentrations of oxygen. And the reason for this is that a lot of these wounds we talked about earlier, non-healing wounds, are suffering from lack of sufficient oxygen.
It is using oxygen which is in the air around us. The only difference is that the concentration is increased and it is at somewhat higher pressure than we're accustomed to. And these circumstances, when you breathe them in, allow for specific changes in the cells which are affected in the wound, wherever there is a problem. And spaced out over several sessions, which can be quite a few, can make a permanent difference in the wounds towards healing, or in the case of radiation bleeding, to stopping the bleeding.
We want patients to be able to get excellent, high-quality care right here locally.
And there are a lot of people out there, a lot of people going to doctors' offices, some who have given up entirely. They suffer in silence. They hide their chronic wounds beneath trousers or long skirts, and they just sort of truck along with life. Well, they don't need to do that necessarily anymore, and that's a great thing. They don't have to deal with the bandages and all the difficulties of changing them every day. The wound care center can do that, and even better, quite often we can effect a cure. And I think that is the most exciting thing of all.